Hello and welcome to our channel. In this comprehensive video, we dive deep into challenging nursing questions related to quality management, tailored for both NCLEX and Prometric exams. Join us to enhance your knowledge and critical thinking skills as we provide detailed answers and thorough rationales to help you succeed in your nursing career. Whether you're a student preparing for exams or a healthcare professional seeking to strengthen your expertise, this video will be an invaluable resource. Let's start. Question 1. A nurse is implementing a plan to improve patient satisfaction on a medical surgical unit. Which of the following actions best reflects a proactive approach to quality improvement? A. Conducting a survey to identify patient satisfaction issues. B. Analyzing data on patient complaints from the past year. C. Implementing changes based on real-time patient feedback. D. Reviewing patient satisfaction scores at the end of the quarter. Answer 1. C. Implementing changes based on real-time patient feedback. Rationale. A proactive approach involves identifying and addressing issues as they rise. Implementing changes based on real-time patient feedback allows for immediate improvement and responsiveness to current concerns. Question 2. A hospital is implementing a new electronic health record system to improve documentation and patient care coordination. What is the nurse's role in ensuring the success of this quality improvement initiative? A. Resist changes to maintain the status quo. B. Provide feedback on the usability of the system. C. Minimize communication with the healthcare team. D. Avoid participating in training sessions. Answer 2. B. Provide feedback on the usability of the system. Rationale. The nurse plays a crucial role in the success of a new system by providing feedback on its usability, identifying issues, and contributing to continuous improvement. Resistance and avoidance hinder the effectiveness of quality improvement initiatives. Question 3. A healthcare facility is implementing a hand hygiene campaign to reduce hospital-acquired infections. What is the most effective method for evaluating the success of this initiative? A. Monitoring the number of hand hygiene posters displayed. B. Observing healthcare providers' compliance with hand hygiene protocols. C. Reviewing the facility's financial reports. D. Analyzing the facility's overall patient satisfaction scores. Answer 3. B. Observing healthcare providers' compliance with hand hygiene protocols. Rationale. The most direct way to evaluate the success of a hand hygiene campaign is by observing healthcare providers' compliance with hand hygiene protocols. Direct observation provides real-time data on adherence to recommended practices. Question 4. A nurse is involved in a root cause analysis following a medication error. What is the primary goal of a root cause analysis in the context of quality improvement? A. Identify individuals responsible for the error. B. Assign blame to prevent future occurrences. C. Understand the underlying causes of the error. D. Implement punitive measures to deter future mistakes. Answer 4. C. Understand the underlying causes of the error. Rationale. The primary goal of a root cause analysis is to understand the underlying causes of an error to implement corrective and preventive actions. Blaming individuals may not address systemic issues contributing to errors. Question 5. A nurse is participating in a performance improvement project aimed at reducing patient falls in a healthcare facility. What strategy is most effective for preventing falls? A. Restraining agitated patients to prevent wandering. B. Conducting regular assessments of patient fall risk. C. Minimizing staff presence in patient rooms. D. Keeping patient rooms dimly lit to promote sleep. Answer 5. B. Conducting regular assessments of patient fall risk. Rationale. Regular assessments of patient fall risk allow healthcare providers to identify individuals at risk and implement preventive measures, restraining patients, minimizing staff presence, and keeping rooms dimly lit are not recommended fall prevention strategies and may contribute to falls. Question 6. A nurse is participating in a hospital-wide initiative to reduce healthcare-associated infections. Which action by the nurse best demonstrates a commitment to infection control? Adhering to PROP. Are hand hygiene protocols. B. Avoiding the use of personal protective equipment. C. Sharing equipment between patient rooms. D. Disposing of used needles in a regular trash bin. Answer 6. Adhering to proper hand hygiene protocols. Rationale. Adhering to proper hand hygiene protocols is a fundamental and effective measure in preventing healthcare-associated infections. Proper hand hygiene helps break the chain of infection transmission. Question 7. A healthcare facility is implementing a plan to enhance patient safety. What is a key principle of the just culture approach to quality improvement? A. Assigning blame for errors. B. Encouraging open communication about errors. C. Implementing punitive measures for all errors. D. Concealing errors to maintain staff morale. Answer 7. B. Encouraging open communication about errors. Rationale. The just culture approach promotes open communication about errors without fear of punitive measures. It focuses on system improvement and learning from mistakes. Question 8. A nurse is involved in a root cause analysis following a sentinel event. What is the nurse's role in this process? A. Assigning blame to individuals involved. B. Implementing punitive measures. C. Identifying systemic issues contributing to the event. D. Concealing information to protect the organization's reputation. Answer 8. C. Identifying systemic issues contributing to the event. Rationale. The nurse's role in a root cause analysis is to identify systemic issues contributing to the sentinel event. The focus is on understanding and addressing underlying causes. Question 9. A nurse is developing a plan to reduce medication errors on a medical surgical unit. What strategy is most effective in preventing medication errors? Administering medications quickly to save time. B. Relying solely on memory for drug dosages. C. Using barcode scanning for medication administration. D. Delegating medication administration to unlicensed assistive personnel. Answer 9. C. Using barcode scanning for medication administration. Rationale. Using barcode scanning for medication administration is an effective strategy to prevent medication errors by ensuring the right patient receives the right medication in the right dose at the right time. Question 10. A nurse is conducting a chart audit to assess compliance with documentation standards. What is the purpose of this audit? A. Identify individuals responsible for incomplete documentation. B. Determine the financial impact of documentation errors. C. Evaluate compliance with established documentation standards. D. Assign blame for documentation discrepancies. Answer 10. C. Evaluate compliance with established documentation standards. Rationale. The purpose of a chart audit is to evaluate compliance with established documentation standards, not to assign blame. It helps identify areas for improvement and ensures accurate and complete documentation. Question 11. A nurse is participating in a multidisciplinary team focused on improving the hospital's response to cardiac emergencies. What is a key component of a successful quality improvement team? A. Assigning blame for system failures. B. Encouraging hierarchical decision-making. C. Promoting open communication and collaboration. D. Concealing information about errors. Answer 11. C. Promoting open communication and collaboration. Rationale. A successful quality improvement team promotes open communication and collaboration among team members to identify and address system failures. Question 12. A healthcare facility is implementing a performance improvement initiative to reduce patient readmissions. What action by the nurse best contributes to this goal? A. Discharging patients without providing adequate education. B. Ensuring timely follow-up appointments and home care services. C. Avoiding communication with patients after discharge. D. Minimizing collaboration with the healthcare team. Answer 12. B. Ensuring timely follow-up appointments and home care services. Rationale. Ensuring timely follow-up appointments and home care services is a proactive measure to reduce patient readmissions by providing ongoing support and continuity of care. Question 13. A nurse is implementing a plan to reduce medication errors on a unit. What is the nurse's most appropriate action? A. Blaming individuals for past errors. B. Concealing information about medication errors. C. Implementing education on medication administration. D. Discouraging reporting of medication errors. Answer 13. C. Implementing education on medication administration. Rationale. Implementing education on medication administration is an appropriate action to Address and prevent medication errors by enhancing staff knowledge and skills. Question 14. A nurse is involved in a hospital-wide initiative to reduce patient falls. What is the most effective way to contribute to fall prevention? A. Encouraging bed rest for all patients. B. Using physical restraints on agitated patients. C. Implementing regular assessments of patient fall risk. D. Dimming lights in patient rooms to promote sleep. Answer 14. C. Implementing regular assessments of patient fall risk. Rationale. Implementing regular assessments of patient fall risk allows for early identification of individuals at risk and the implementation of appropriate preventive measures. Question 15. A nurse is participating in a quality improvement project to reduce surgical site infections. What is a key element in preventing surgical site infections? A. Delaying the administration of prophylactic antibiotics. B. Maintaining a high level of traffic in the operating room. C. Using sterile techniques during surgery. D. Ignoring the patient's medical history. Answer 15. C. Using sterile techniques during surgery. Rationale. Using sterile techniques during surgery is a key element in preventing surgical site infections by minimizing the introduction of pathogens into the surgical site,